What's up, guys? Today we're going to be talking about the adductor canal. It's also called the hunter's canal or subsartorial canal. It's a very easy to find landmark. You're going to look for our sartorius muscle, and then it's everything deep to it holds our contents, okay? So you have the adductor canal, and it could be used or change the name between subsartorial canal or hunter's canal. Our subsartorial canal is named because of that fascia that is over the top of it. So knowing all the names is important for testing because they could be used interchangeably once again. So it's roughly triangular in cross sections, and it's located deep to our sartorius muscle or our seatbelt muscle, as SpongeBob just showed us. So let's look at our landmarks and our borders. So we have our posterior border, which is our adductor longus and adductor magnus muscle. Our anterior medial border is our subsartorial fascia, and our anterior lateral border is the vastus medialis muscle. Okay. The contents are going to be very important. These are structures that are very important, which is why we even recognize the space. It's our saphenous nerve, which runs medially through the body, our femoral artery, and more specifically, it's our superficial femoral artery, which has a couple branches, which we'll get into in just a second, and our femoral vein. So let's get into the femoral artery or our superficial femoral artery. It'll give a couple different branches, our descending genicular artery, and then our saphenous artery, which will run with our saphenous nerve and saphenous vein medially down the body, and then our articular branch. Our superficial femoral artery, once it goes through our adductor hiatus, becomes the popliteal artery. So on our 3D model here, we found our sartorius muscle. It's our seatbelt muscle. Remember SpongeBob seatbelt? And let's see that straps all the way across the body like a seatbelt would. So we see our femoral artery, our femoral vein, and then we see that saphenous nerve right there as well. So those are our contents within our adductor canal. See our vastus medialis. See our adductor magnus. And then we also see our adductor longus as well. And our vastus medialis, which is our anterior lateral border. There's our adductor longus. And once again, our femoral artery is actually split into our deep or profunda femoris artery and then our superficial femoral artery. The superficial femoral artery will have that last branch, that genicular artery, which has two branches on its own, our arcuate artery and our saphenous artery. And it goes through the adductor hiatus, becoming our popliteal artery that will go and supply the rest of our lower extremity. All right, guys, thank you for watching. Please subscribe and like the video if you found it useful. Appreciate it, guys.